Hi there, it's Rebecca from OET, and I'm here today to help you with your preparation questions for the test, either coming up this weekend or maybe a little bit further ahead into November and December. I've been having a few technical issues, so I'm really sorry if you've been trying to join the session for the last 10 minutes. The issues seem to be around being able to ask questions. So if you have been trying to join the session and not able to get through, please let me know if this is now working properly by typing a question or a comment into the box so I can see some of these questions coming through and we can continue with the session. I'm able to ask any questions that you might have about tips and strategies for the different parts of the test, or perhaps any questions that you have about getting ready for test day. So as soon as you have a question, do type it into the box and I will answer as many as I can during the session. As I've mentioned, for those of you who are just joining me, there does seem to be a little bit of an issue with Facebook Live today. I'm not sure that questions are coming through. I'll just give it a few more minutes to see if any questions do come through to me so I can answer them. Otherwise, I may have to do something slightly different and just talk to you a bit more generally about preparing for the test. And hopefully we'll come back in a different session to answer questions if this isn't working. I can see that there's a lot of you online with me right now, which is great. There's over 70 of you, but I'm still concerned that there are no questions coming through. So if someone is able to type in a comment into the box that is at the bottom of the post, and then I can see those are working, that would be really great. I'm assuming, though, that perhaps you are trying to do this and for some reason the technology isn't working. So what I'm going to do, I think, rather than just end this session and sort of miss this opportunity completely, I'll just spend a bit of time talking to you about the different parts of the test. And then, unfortunately, we'll have to leave the Q&A session for another day, unless the questions start coming through, and of course I will start to answer them. So let's talk more generally about different parts of the test. So often candidates in these Q&A live sessions have a lot of questions about the writing test. So I'll start with the writing test and then move on to other parts of the test after that. So depending on your profession, the writing test may be a different type of letter, but all professionals for OET will write a formal letter about a patient or a set of case notes about a patient that they are given. Now, before the writing time starts, you have 5 minutes to read that information about the patient and to really understand who you are writing to, because this information, who you are writing to, who is your reader, is the most important piece of information you can find on the case notes. So my advice would be during the reading time that is the information you focus on. Go to the end of the case notes to where it says the writing task, and there you will find who it is that you are writing to, and that information is going to help you make a decision about what information to include or omit from your letter once the writing time starts. So you have 5 minutes. You can't do any writing, circling, underlining during that 5 minutes, but those 5 minutes are there to help you really understand what the case notes are about, and to be able to write the task. Great, I can see some questions are starting to come through now. So I'll stop there in terms of the general advice and turn to the questions. But obviously, if anything I've already said is useful, then please ask me a question about that. So Sangam says, is it necessary to write down past medical history in a separate paragraph, or can you correlate it with things in any paragraph? So actually that ties into what I was just explaining, Sangam, that with the reader being the most important person that you need to consider in the reading time, this will also tell you how to structure your letter. You need to decide how to organize the information in your letter based on what the reader would find most important. Now, in some situations, past medical history may be extremely important, and there might be enough of it to write as one whole paragraph. But in other situations, maybe only a small amount of past medical history is relevant. And in that case, you might be able to combine it with other information, perhaps social history that is relevant and so forth. So it's really understanding who is the reader and what information they would consider important that will help you decide how to join information together, how to structure it. Tara looks like she's asking something quite similar. For the organisation and layout criteria, you've advised previously to arrange the paragraphs in order of importance. However, giving the story in chronological order is often easier to understand. Would I lose marks for arranging the paragraphs in chronological order instead of order of importance? E.g., patient's current state is obviously the most important to the reader, but I give the story chronological. All right, so sorry, that's a long question. I'm just sort of reading the gist of it, Tara. So from what you've said, I agree with you that chronological order does tell the story quite well. But in terms of organisation and layout, the chronological order would only be used in certain situations. And in one situation where I think it's not appropriate to use, that would be in an emergency or really urgent situation. Then you need to imagine that the reader has the letter and the patient in front of them, and they need to take some kind of action because this is an emergency situation. For them, what they need to know right now, is, as you've admitted, is what the current condition is. And so for them to understand that first, and then to be able to read back through the history after that, would still be the most important choice. And so if you weren't to do that, if you were to go through it chronologically, then that would affect your score for this criteria because you haven't considered the needs of the reader. So chronological order will work for some situations, but not all situations, and that is the consideration that you need to make. Gray says, in the writing subtest, do I have to stick with the task, or do I have to keep in mind the scoring technique? Oh, so sorry, I think you're actually asking about the speaking subtest. So do I have to stick with the task, or do I have to keep in mind the scoring technique, just like in the information giving of clinical type criteria? In the scoring, that states encouraging the patient to share his thoughts. Okay, these are good questions, Gray. So the explanation of the different criteria are there to guide you to understand what the assessors are looking for. However, the breakdown of those criteria may not all be included in 100% of the tasks. These are examples of how you can demonstrate this particular criteria, but some of those examples may not match to every single task. And so you shouldn't expect to have to cover all of those examples, all of those descriptions of the criteria every time you do a speaking task. So I would obviously get a really good understanding of the criteria and make sure that you are able to do all of those things when you practice. But during the test, it's much more important to have a natural conversation with the patient and to focus on the tasks, what you need to discuss, and responding appropriately to the patient. Tara says in another question, in terms of appropriate connecting words, you've mentioned previously that in addition is fine while furthermore is not suited for the genre. What other connecting words have the same meaning as in addition, which is appropriate? Is further okay, is nevertheless also too academic? So Tara, we actually have a help article just on this topic. I'm just going to quickly look it up for you, and then I can post it as a link into the comment box, because I think the article will actually explain our advice much more clearly than I can in this recording. So have a look now. That article is coming through, and that will give you the answer to the questions you have. Lakshmi says, can you give a sample for the introduction of a letter? Again, better than me trying to do something on the spot off the top of my head. I'm going to post another link into the comment box right now, and this link is to our sample answers or sample tests. For each of the sample tests for writing, we have a sample answer that you can look at. And my recommendation is not just to look at the sample tests and the sample answers for your profession, but instead to look at the samples for all of the professions, because what I'm going to encourage you to look at is how the writers for these sample answers have personalized the introduction to the situation, to the case notes that they are writing about. You will see that each introduction is different, and this is a really important lesson for all OET candidates to learn. There is not one perfect way, one perfect sentence that you can use 100% of the time. Where you're going to get a good score for the purpose criteria is by being flexible with language and writing an introduction that matches the situation and is appropriate to the situation you're describing. Jay says, please explain the new criteria in writing. So again, here comes another link because on our website there is many useful pages and help articles for all of these types of questions. And the writing criteria were amended at the end of August for the August 31 test date. They weren't changed very drastically. There used to be 5 assessment criteria, and these have now been reclassified into 6 criteria. But what we are asking candidates to demonstrate hasn't changed from the previous criteria to now. In fact, part of the reason for updating the criteria was to make them much more clearer to candidates to understand what it was the assessors were looking for in their writing. So I've posted that link there at the bottom of the comment box. Have a look at it afterwards. There's lots of links on that page, so make sure you click on all of them to get the best information. Got a question here asking reading part A strategies. So reading part A is a timed test. You have 15 minutes to answer 20 questions. And the aim of this test from the employers and regulators' point of view is to check that you can quickly and efficiently find specific details under time pressure, because they tell OET as we design the test that they value employees who have these skills, because in the workplace sometimes you are required to find specific information very quickly and to take some action with it. So a couple of tips for reading part A. Do the questions in the order that they are given. So questions 1 to 7 are specifically designed to help you understand a general overview of what each of the 4 texts contains. So do those questions first. They're very simple to answer. You just have to write down letter A, B, C, or D. So very quick to write down your answers for. But doing them in that order will then make answering questions 8 to 20 more straightforward, because you now have this general overview of the 4 texts, as I mentioned, and this will help direct you more quickly to where you will find the answer to questions 8 to 20. My other tip for reading part A is make sure your spelling is 100% accurate. For reading part A, you cannot make any spelling mistakes. If you do make a spelling mistake, you will score 0 for that answer. All of the answers come directly from one of the texts, and you just need to copy the words from the text into the answer. So you don't need to make any changes to the words from the text. And so just make sure to spend a few extra seconds once you found the answer, making sure you copy it down onto your answer paper correctly. Don't waste any marks. Claire says, what is the difference between the new criteria and the old one with regards to the construction of the introduction? Claire, in fact, there's no difference. Even with the old criteria, our advice was exactly the same. And this was that when you're writing a letter, you always need to explain why you are writing at the start of it. This is the way that English writers will start a letter. So there's been absolutely no change there. We still recommend explain why you are writing and introduce the situation or the patient so that the reader is clear about who you are writing to. So that hasn't changed. Lakshmi says, besides suffering from are these words that can be used for writing. So Lakshmi, I would suggest that besides is very informal, and so wouldn't be appropriate for the formal writing that you need to do for OET. Suffering from is an interesting expression. We know that many healthcare professionals use it. However, if you were to ask the patient if they agree with your assessment of suffering from, particularly for chronic conditions like asthma or diabetes, they're likely to disagree with you. They wouldn't agree with the negative connotations that comes from suffering. They might say, this is just part of my lifestyle. You know, I live with diabetes, but it's managed with medication or lifestyle changes. I don't agree with it that you say I'm suffering with it. So for this reason, we recommend that instead of using suffering from, you just keep it very factual and say the patient has diabetes, for example. Asha says, is there any negative marking if we mistakenly include some irrelevant data? So Asha, one of the assessment criteria for writing is called conciseness and clarity. And this criteria focuses on whether you have provided an efficient summary of the situation for the reader by omitting unnecessary details. And so to answer your question, you would receive a lower score for conciseness and clarity if you have included irrelevant information that the reader doesn't need to be able to care for this patient. JD says, from 31st of August, the OET criteria changed, and I noticed the results from August were not pleasing. So Jay, actually, the assessment for 31st of August will have been exactly the same as for previous versions of the test. The assessors use those assessment criteria to grade the marking that was there. So if you were receiving a score that you are unhappy with, unfortunately, it meant you weren't demonstrating a high enough level for those assessment criteria. From month to month, the assessors are trained and their marks are standardized. At least 2 assessors are used for each candidate's writing to check that the assessment agrees with each other. So it's not just one person's opinion, but they are using these assessment criteria to score what you have evidenced in your test paper. Sundra Kumar says, do we need to write past medical history in the discharge letter? So any kind of letter and any kind of information, the way that you decide whether you need to include this or not goes back to my point at the beginning about who is your reader. So if your reader needs to know some past medical history, maybe for context, perhaps if the person you're discharging the patient to is already familiar with the patient, you might just mention past medical history as context. However, if there's any new medical history that the reader wouldn't know and they need to know to be able to continue caring for the patient, then you should include it. Jen says, are we reminded of the remaining time we have during reading and writing on test day? Yes, Jen, you are. The invigilators at the front of the test room will remind you when you have 5 minutes remaining for those tests. Another question, can we start the paragraph like, in terms of social and medical history of Mr. X? This could be possible. I'm not going to suggest that this would be used in every single letter or every single scenario. In terms of, it should be in terms of Mr. X's social and medical history rather than the way that you have written it. But this is one option for starting such a paragraph. Deeka says, what do you advise are the strategies for reading Part C? So with reading Part C, what I find candidates tend to do is not really understand the question carefully enough before trying to find the answer in the text. So there are a couple of strategies that I recommend for students, particularly if the question is quite long or it's a sentence completion question, which means essentially the question is the first part of the sentence and A, B, C, and D are the possible ways to finish the question. With that kind of open-ended question, I think it's quite useful just to spend a few seconds paraphrasing that into an actual question. So turn it into a who or a what or a why question, so that you really are sure that you've understood what the question is asking for. Then the other strategy that I would have is for the 4 answer options, really focus on the differences that are there between the 4 options, because it's the differences that are going to help you to decide which of those is the correct one. For example, look at whether all of them are a negative idea or all of them are a positive idea. Look at what the meaning of perhaps the verb means in that sentence. Sometimes there can be very similar verbs used or similar adjectives used, and in that case where they are similar among the 4 options, again, you can ignore them because you're really trying to work out what is different between those 4 answer options, and then go back to the text, thinking about those differences, and find the one that best matches what you read in the text. Harsh says, I'm not happy because they don't give headphones while listening, which makes it hard to concentrate. I do understand that in many situations, as individuals, you enjoy listening with headphones. This is very popular, obviously, with people listening with headphones on their phone and so forth. However, in real life, as healthcare professionals, the listening that you need to do and to be able to demonstrate to your employer is done without headphones. So you speak and listen to your patients and to your colleagues without the use of headphones. And for this reason, OET in most venues does not use headphones. So my advice would be, don't practice listening for OET using headphones. Instead, use the speakers on your laptop or the speakers on your phone to practice listening without headphones. And then when you get into the test, you won't feel so strange, because you're actually listening in a slightly different way to how you have practiced. Angel says, regarding the new writing criteria, is the purpose written immediately at the first sentence of the introduction, or is it okay to be written anywhere in the introduction? It's a good question, Angel, and the guidance that we give you on the writing page of the OET website is that it should be immediately apparent, but that means within the first paragraph. It doesn't necessarily have to be the very first sentence. For example, you might introduce the patient or the situation first and then provide the purpose, or it might be the other way around. As long as it's there at the beginning in the first paragraph, that will be fine for the purpose criteria. Sangam says, can you please elaborate what to keep in mind when writing a discharge letter apart from a referral letter? So I've had a few candidates ask me, they seem quite concerned about writing a discharge letter as opposed to a referral letter. However, there's very little difference between the 2 types of letter. Obviously, with a referral, you're passing the patient's care perhaps to a specialist or somebody who has more responsibility than you do to continue caring for the patient. Whereas discharge, you might be returning the patient back to a previous carer. And so from that respect, they're different. But in your approach to writing a discharge letter or a referral letter, your approach will be the same. You need to make the same decisions about what to include or not to include. You need to structure the letter based on what information the reader would find most important. So from that respect, don't try to consider a discharge letter as something very different to a referral letter. In fact, they're very, very similar. It's just what's happening to the patient that is different. Good. Sorry, just scrolling down, looking for some new questions. Tara says, with regards to writing, what tense should be used for the history and examination findings today, which are ongoing? For example, Mr. Smith presented today with a sharp right-sided chest pain. He has had a cough. Yeah, all of that looks fine, Tara. So generally with the examination, because at the time of writing your letter, the examination is complete, the findings are in the past, you would often use the past tense to record what those findings, what that examination results demonstrated at that time. Asha says, I have a question regarding the reading and listening. When we are answering, if there is an extra word missing, for example, an article or preposition, will you give the mark or not? For example, the answer is night security guard. And if I wrote security guard, will they assess? So Asha, there's two parts to your answer because it's slightly different for reading and for listening. So for reading, first of all, for reading part A, you must copy the answer directly from the text and you cannot make any spelling or grammatical errors in reading part A. So if you are getting the grammar wrong, for example, missing plural S off the end in reading, then this would give you 0 for that question. The opposite is really true for listening part A. In listening part A, the assessors are much more flexible, and so they are able to overlook grammatical mistakes and spelling mistakes. However, with your example, not including the word night could make this answer incorrect because you're missing out a qualifying word which gives more detail about the type of security guard the patient is, and obviously that could have some impact on his health. You know, the fact that he's a night security guard rather than a day security guard could have some impact, so make sure you are including all of the details in the answer. Julita says that you're appearing for the test this weekend, help with some writing tips. So Julita, hopefully listening into what I've already explained with writing is helpful. However, if you have a specific question, do ask and I'll be able to answer it. Lakshmi says, is reduced word count give a low writing score? The answer is not necessarily. So what the assessors are looking for is whether all of the relevant and important information that the reader needs has been provided, but at the same time, whether irrelevant, unnecessary information has been omitted. So if you have managed to do those things but have written less than 180 words, that won't affect your score. However, if you have written less than 180 words and you're missing something important that the reader needs, in that example, then that would affect your score for content because you've missed out some important details. Renju says, in letter writing, can I write admitted to the hospital or admitted to hospital? So Renju, the phrase in English is without the, so admitted to hospital. The only time we might use the is when we name the hospital. So for example, Mr. X was admitted to the Alfred Hospital, because then we're talking about one specific hospital, and that's when we would use the. But if we're not naming the hospital, it will always be admitted to hospital. Tamer says, can we omit the medication dosages in a referral letter or it will affect the score negatively? So this comes down to whether the reader needs the dosage information to be able to continue caring for the patient. And this will come from the task that you are writing about. For example, if the task is to write to a professional, asking them to monitor the patient's medication compliance, then they would need to know the dosages of the medication to be able to complete that request. In other situations, perhaps where the reader will not be monitoring the medication or having anything to do with the medication, in those situations, then the dosages could perhaps be omitted. Tim is asking a very similar question that I've just answered about listening part A. So in listening part A, the assessors are flexible in terms of grammar and spelling mistakes. And so you don't need to worry about having everything perfect in listening part A. You will still get the score, the correct answer mark, sorry, if you have made small grammar or spelling errors. Christine said, is it okay to use dear sir or madam on writing letter if no specific name, or using dear nurse or dear dietitian would be more appropriate? In healthcare letters, it does seem more appropriate to use the reader's job title rather than dear sir or madam. However, this wouldn't count against you if you did use dear sir or madam in the test. So a couple of questions here about changes to the writing test. I think I've already covered those questions. So if you didn't hear me answer those questions a little bit earlier, at the end of the hour, this recording will be available for you to listen to. So do listen at that point to hear the answers that I gave to those questions. Aswani says, in speaking, if we complete all the tasks, can we score a B grade? So Aswani, it's not a requirement to complete all of the tasks to get a B grade. You can still get a B grade even if you haven't managed to complete all of the tasks. The focus in the speaking test is on having a natural conversation between the professional and the patient, and that means things like giving the patient opportunity to speak, responding appropriately to the information the patient gives you, etc. So obviously don't waste time, don't introduce other points that aren't part of the tasks, but also don't worry too much if by answering the patient's questions, responding to them appropriately, you're not able to complete all of the tasks. You are still able to get a B grade in that situation. Tara says, are the sample letters on the official website A or B standard? So Tara, they haven't actually been assessed because these letters were produced by native speakers, and they are designed just to show a good example of how a healthcare professional, because they've all been checked by healthcare professionals, would answer this task. So you can consider that they're not supposed to be perfect, but they are a very good example of how to write a letter for this task. Shiny says, do we need to expand mg in 5 milligrams into words? No, that's absolutely fine to use the short form of mg in your writing. Drew says, do we always need to use the specific patient's name when we write a letter? Why the word the patient is not appropriate? So Drew, the reason why we recommend using the patient's name is because it's more polite and it makes the letter more personalised for the reader. Obviously, the reader will have many patients that they are responsible for, and so it's helpful for them if you mention the patient's name each time rather than just the patient, because it keeps their focus on which of their many patients you are focusing on. There is one part of the letter where you might mention a patient rather than their name. This could be, for example, in the introduction when you say, I'm writing to update you about your patient, Mr. X. There, that would be okay, but during the rest of the letter, we would recommend using the patient's name, not the patient or the client, for example. Nimi says, which is more appropriate, to start with the name or I'm writing to refer? These are both two options, Nimi. One is not better than the other. As I mentioned earlier, the best students for writing will be flexible and be able to write an introduction that is personalised to the situation they are writing about. Simi says, is it needed to use master before the name of a below 15-year-old child? So our advice, Simi, is where the patient is a child, and what we classify as a child is someone who is 16 years or younger, then you don't need to use a title unless one is given in the case notes. If you find an example where a title is given for a child, then of course it wouldn't be wrong to use it. However, in our understanding in real life, in healthcare scenarios, titles are not used for children 16 years and younger. Deepa Rimani says, could you please tell the use of comma when writing tablets? For example, tablet paracetamol 500 milligrams twice daily, where to put the comma? I would put a comma after paracetamol. Gray says, in speaking, sometimes we mindlessly just read the task because of time constraint. What will happen if I didn't paraphrase the task? So Gray, you have 5 minutes to speak about this situation. It may be that what you're describing happens towards the end of the time. But what I would suggest is don't focus so much on sort of completing the tasks or doing what you've said, doing things mindlessly. Instead, try and imagine that you're speaking to a real patient. And this means to try to engage in a natural conversation with them. So this means asking them to share information. It means responding to what they tell you, and so forth. You're going to get a good score if you are able to use your own words, to use the tasks to create a conversation. And so if you were doing a lot of just reading from the card, this would end up impacting your score. Christine, so you're asking a related question to do with speaking. Can you give advice about how to relax during the speaking test? So exactly as I've just described, actually, Christine, my advice would be to try and imagine this isn't a test, but instead the person that you are speaking to is a patient. And in many respects, the person you are speaking to, the interlocutor, is just like a patient. They're not a healthcare professional. They're not a healthcare expert. They don't know very much about the situation that they have on the card in front of them. And so equally, they might be feeling a little bit anxious. They don't have a script to talk to you about. And they are listening to understand the information that you are providing them. So I think the best way for you to relax and to not feel nervous is to imagine this is a normal working day. I'm talking to a patient. This is what I need to talk to them about. Other things to remember is you're not being assessed on the accuracy of the information you provide in terms of the medical information. So if you invent something or afterwards you remember that you said it should be ointment rather than it should be antibiotics, that's not going to affect your score because the interlocutor and the assessors are not healthcare professionals. Simon said, is it necessary to write the patient's full address in the letter, or where should I write the address? So Simon, there's no requirement for you to write the patient's address in the letter, even if it's home visits and even if the address is provided as part of the case notes. The only address that you are required to include is the reader's address, which is found in the writing task information at the end of the case notes. If you were to write the patient's address, it would simply be ignored by the assessors. So my recommendation is don't waste any time writing the patient's address. Spend the time more wisely on writing the letter or proofreading it at the end. Aswani says, can you please give some tips for near-miss candidates to follow while appearing for the next exam? So Aswani, it really depends on your own evaluation and assessment of your strengths and weaknesses. For someone who didn't quite get the scores that they wanted, this will come down to whether it was something that happened in the test day. For example, they were very nervous, or they realized afterwards that perhaps they didn't answer the question carefully enough or accurately enough, or whether it's down to a language skill causing the problem. And so to understand that is going to be the most important thing to then improving on that for the next time you sit the test. Safar says, is OET going to be accepted in Canada for doctors? This is our intention. We are working with colleagues and regulators in North America currently. We're working to see the test recognised there. However, this is going to take some time. And of course, as soon as we have any information, we will share it with candidates. But hopefully in the future, at some time, I don't know when, it will also be accepted in North America. Deepa says, you told to copy answer directly from text from part B. I think you mean part A. I've seen some material, for example, the text has constipation, but the answer shows constipated. So Deepa, this material that you've been looking at, therefore, is inaccurate. And this is actually a really important point that I want all of you to be aware of, that out in the internet, sharing on WhatsApp groups and so forth, people are sharing unofficial materials that are very poor quality. So if you see something that doesn't match the instructions on the sample test from the OET website, then you shouldn't bother with those materials. They are bad examples and they are misleading you about what you need to do for the test. So the example that you shared there tells me that these are not official materials and they are poor quality, and they're actually damaging your chances of success on test day. Yasoda says, will I lose marks for missing out on the salutation? This would affect your score slightly if you've missed out the greeting at the start or the salutation at the end of the letter, because obviously this is part of the format of writing a letter. So in organization and layout, for example, if you miss off the ending to the letter, that would have a slight impact on your score for that criteria. Fakrul says, if all relevant information is there but the word count is 230 to 260, will I be penalized? Fakrul, my thoughts are to that question, if you've written 230 to 260 words, one of two things has happened. One, that you've included some information that the reader doesn't need to be able to continue caring for the patient. Or two, the way that you have included all of the relevant information could have been written more effectively with less words. So it is, I know some people's writing styles to be very wordy in the way that they explain situations, but healthcare professionals value succinctness, which means using as few words as necessary to explain something. So my feeling there would be that you've done one of those things. If it is that you're writing things in a very wordy way, that would be something to practice and improve on, to try and write things more efficiently, covering the same information, the same detail, but just with less words. Miriam says, is it okay not to include Mr. or Mrs. when it's not indicated in the writing task? Absolutely, that's fine. However, in official OET test tasks, the title is given so that won't be an issue. So again, that sounds like an unofficial practice task. And as I've said, please be careful about using unofficial practice materials. They may be very poor quality and mislead you about the test requirements. Majid says, in the speaking test, if the setting is the emergency department, is it necessary to address yourself? So Majid, in that situation, I think I would, as a maximum, introduce myself by name. For example, hello, my name's Rebecca. I'm here to help you with your situation, for example, or can you tell me some more about the pain you're in at the moment? That would be sufficient for an emergency situation. I wouldn't be introducing my name and my job title and so forth because the patient is requiring much more immediate treatment. Manoj says, in the writing task, what's the approximate score to get a B grade? So Manoj, I can only advise on a B grade, and this is a very approximate score because remember that when you're practicing for OET, you shouldn't just aim for the minimum score that is advised to get a B grade. If you're only aiming for the minimum, then there is a good chance on test day that you won't hit that minimum for reasons to do with nerves or stamina and so forth. However, if you're aiming slightly higher than the minimum during your practice, then that will create allowance for any problems that you do experience on test day. So for writing, we're advising that candidates aim for a 3 in purpose and at least a 5 across all of the other assessment criteria. You do need to get consistent grades, consistent scores, so you can't be getting 5s in some of them and 3s in others. You do need to be getting consistent scores if you're going to end up with a B grade. Asha says, when writing a letter to a nurse or doctor, can we use commonly known abbreviations? So Asha, the decision here is you're writing a formal letter to a healthcare professional. So as you mentioned, the healthcare professional is likely to know these abbreviations. But when we use many abbreviations in writing, the result is very informal. And so our advice is to use a minimum number of abbreviations. Instead of abbreviations, using full forms will end up with a more formal looking letter, and that's our advice. So perhaps if the situation is osteoarthritis and you need to mention that several times in your letter, you could use the abbreviation OA in subsequent times where you would otherwise have written osteoarthritis, but I wouldn't be including many abbreviations in your writing. Aliana says she was commenced on aspirin. Is this sentence wrong? No, that sentence is absolutely correct. So please let us know where you are hearing that this information is wrong, and we can try and contact the source of that information to advise them that they're misleading candidates. Getcha says, is it okay to use brackets in writing? So brackets and abbreviations, we have very similar advice for. It's okay to use a minimal number of brackets, but again, if you are overusing them, then it ends up creating quite an informal looking letter. So we wouldn't be recommending multiple uses of abbreviation. Fakrul says, please let me know when to capitalize. How should I know about all medicine brand names? I'll answer that first part of the question and then answer the second part. So Fakrul, the general rule for medications is if it is a generic name, it will be not capitalized, whereas a brand name will be capitalized. Often in test day tasks, these days, OET will provide both the generic and the brand name so that you'll be able to know which is which in the case notes. If you make a mistake with capitalization, it's not going to affect your score for the medication if you make a mistake and you capitalize it when it didn't need to be capitalized and so forth. And the second part to your question, do I need to use medicine doses and daily intakes in details? So we would encourage you to expand BD to twice daily, again, down to the formality, really. Liam said, is there a possibility that OET can be accepted in the US for visa screening? So Liam, again, as I mentioned a little bit earlier, we are discussing OET recognition in North America currently. It's likely to take some time, and first of all, it would be recognition from the healthcare boards. Visa recognition is likely to come at some later time. Of course, we'll keep you updated with any news, but it will take some time for us to be able to gain this recognition. Abdul says, can our writing include difficult medical terminology, for example, biliary colic rather than gallstones? Absolutely. If you're writing to a healthcare professional and they would be familiar with that terminology, absolutely you can use that instead of the more common layman's terms. Tin is also asking about whether you need to include your address or the patient's address. The answer to that, as I mentioned earlier, is no. The only address that you are required to include in the letter is the reader's address provided for you in the task information. Any other addresses included in the case notes do not need including in the letter. Kang says, can mixed types of verbs be used in a sentence? For example, a positive home ovulation test confirmed that she is still ovulating. Yes, that's a good example of a sentence where you have used verb tenses correctly. Li Ji says, is it necessary to write the duration while writing the past medical history? I would suggest yes. If the past medical history is relevant to the reader, then the duration of that history is also likely to be relevant. Yeah, I would recommend so. Okpagor said, I read in an OET official blog about an acronym reader on the writing task. Can you please expatiate on it. I can't really add more to that blog post. We have used a helpful mnemonic reader to help candidates understand how to focus specifically on the reader's needs. So reading that blog post would give you all the information you need about our advice on that point. Krishnendu says, is it compulsory to write has been throughout the letter? No, and I'm not sure where you've heard that from. Has been is a present perfect verb tense, and the requirement for OET writing is to write natural English using a variety of verb tenses. So you need to use the verb tense that is appropriate to the situation, and certainly not, I'm quite worried by advice that candidates are being given if they're told they need to use has been throughout the letter, or that you should always do this or never do that. Please do double check if you're hearing information like this through WhatsApp groups or from providers, then do contact OET for clarity, because only OET can give you the accurate information. One other piece of information on that note that I'll just mention is we're aware that some candidates are writing their letters on every other line. This is not advised. The practice is not a good one because it can lead candidates to run out of space to write their letter. Please write on every line, but leave one line space between paragraphs. So that's the only line space that you need to leave, not within the paragraphs to write them on every other line. Write on every line and leave one line space between paragraphs. That's the advice that we would use. Grey Shell says, what sample situations would I write the letter in a chronological order? So chronological order is a structure choice that you can make depending on the reader and how they would find it clearest to understand the situation. Chronological order could be for something quite routine, where the patient's condition has improved or deteriorated over time, and you're trying to demonstrate that information to the reader to show them how the situation has changed over time. Hala says, divorced woman, is it Mrs. or Ms.? So this will depend from woman to woman, I'm afraid, but in the case notes for OET tasks, a title is provided, so you can just copy this from the case notes. Manju says, if the speaking time exceeds 5 minutes, it will not be considered for a B grade. So Manju, the interlocutor in the room who's playing your patient during the speaking test has a clock in front of them, and they will stop you after 5 minutes. So you will not be able to exceed 5 minutes. Instead, you will be stopped when the 5 minutes is completed. This is similar to a question I was asked earlier. In those 5 minutes, you should try to cover as many of the tasks as possible, while making sure that you are giving the opportunity to the patient to speak, to respond to what the patient tells you, so that they can ask you questions and you can explain information clearly to them. So that's much more important than completing all of the tasks. Liam says, how do you get 3 points in purpose? So to get a good score in the purpose criterion, I posted earlier a link to the writing page on the OET website, and this will give you more detail about this. But in summary, to get a score of 3 in purpose, you need to do a couple of things. So in the beginning of your letter, at the start of your letter, you need to explain why you are writing and to clearly explain that to the reader. And then later in the letter, you need to expand on that reason for writing. So an example I often give is if you are, the task is that you need to refer the patient for home visits. In the beginning of your letter, you will mention that that is the reason for writing, that you need to request home visits for the patient. Later in the letter, perhaps in the last paragraph, you would provide more details about those home visits. So for example, how many times a week, what activities they will do to support the patient during that home visit, and so forth. Jay says, in speaking, do you have to introduce yourself again in the second role play? And is it necessary to ask the interlocutor what they prefer to be called in the second role play? So my advice would be with the second role play to imagine that this is a different patient. I know you're still sitting there with the same interlocutor, but don't worry about the fact that you've already done that in the first role play. This is a new patient, a new situation. So yes, if it's appropriate to the task, for example, it's clear from the information on your role play card that you haven't met this patient before, then yes, do introduce yourself and ask the patient's name, perhaps, if that's also appropriate. Remember, with the patient's name, the interlocutor's name, you don't have to ask them for that during the role play time. You can ask in the preparation time what name they would like to be called, and then you are able to start the role play using that information. So for example, hi Jay, good to see you again. What can I do for you today? That would be absolutely fine in some of the role play situations. Julita says, if the date isn't mentioned in the letter, what should be the date? So Julita, this won't be an official OET task that you're talking about, because all official OET tasks will include a date in the letter, usually the discharge date or the last date of consultation or whatever. So again, this has been mentioned a couple of times now in the last hour. Please avoid using unofficial practice materials. They could be very poor quality. They could be giving you a misleading view of the test and affecting your chances of success. Manoj says, out of the 6 assessment criteria, is there any criterion that would considerably reduce the total score to less than 250? Each of the criterion are assessed on their own merits. So if you score poorly in one criteria, it doesn't necessarily mean that you will also score poorly in another of the criteria. They are all assessed individually against the letter that you have produced. But that does mean that to get the 350 that you need for a B grade, you will need to get a consistently good score for all of the 6 criteria. Simi says, do I need to expand the abbreviations, CT, MRI, ECG, and so on in my letter? So the 3 examples you've given there, Simi, in those cases, those abbreviations are actually more common than the full forms. So our advice with abbreviation is, if it is a very common abbreviation, more common than the full form, then those abbreviations you don't need to expand. I've just got time to answer one last question. So this is the one, it comes from Medjit, which says, in a writing task, if asked to write to the patient's own GP, is it necessary to add previous medical history or only to add current developments? So it may be useful just for context to briefly mention, just in a sentence perhaps, previous medical history. As you know, Mr. X has recently been hospitalized for treatment for pneumonia. Something like that could be appropriate if it's to the patient's own GP. Thank you very much for joining me today. I'm sorry about the technical difficulties we had at the start of the session. Fortunately, they resolved themselves and I've been able to answer a really good number of your questions. If I wasn't able to get to your question today, do send us a message through Facebook and we will be able to respond to those questions for you in the next day or so. In the meantime, if you are preparing for the test this weekend, remember to focus on your confidence for the next couple of days, revising the things that you've already studied, making sure you get a good night's sleep and you've got all your test day stationery and ID, etc. ready well in advance of the test day. Otherwise, if you're preparing for December or even January in 2020, I'll be back next month with some more Q&A live sessions and you'll be able to contact me again for these and I'll be able to help you. Thank you again for joining me. I hope you have a great test day experience if you're taking the test this weekend. Bye for now.